Dr. Thompson, welcome back. Please proceed.
Good morning, and thank you, Chairman Harkin, Ranking Member Alexander, and distinguished members of the committee for holding this hearing. My name is Kasey Thompson, and I serve as Vice President for Policy, Planning, and Communications with the American Society of Health System Pharmacists. I'm here today to provide ASHP's perspective on the committee's draft proposal on pharmaceutical compounding. As stated in previous testimony, in the interest of patient safety, ASHP supports closing the regulatory gaps for a category of commercial compounding outsourcers we are now referring to as compounding manufacturers, and we applaud the committee's efforts to accomplish closing these gaps. We believe this proposed legislation addresses the regulatory uncertainties that were caused through various challenges to Section 503A of the Food and Drug Administration Modernization Act of 1997. Importantly, the committee's proposal leaves traditional compounding as a core component of the practice of pharmacy under the purview of state boards of pharmacy. ASHP strongly supports the creation of a category known as compounding manufacturer, which would fall completely within the purview of the FDA. We further agree that not allowing a compounding manufacturer to register as a pharmacy in any state establishes a clear boundary between FDA jurisdiction and the jurisdiction of state boards of pharmacy. Being under the purview of the FDA gives the public the certainty of knowing exactly which regulatory body is accountable and will help prevent an entity like the New England Compounding Center from inappropriately operating as a pharmacy ever again and harming our patients. The proposed legislation assures hospital and health system pharmacists, physicians, and other purchasers of compounded products that compounding manufacturers that prepare sterile products have taken the necessary steps to ensure their facilities meet the most rigorous current good manufacturing practices, have been inspected by the FDA, and most importantly, do not pose a threat to the patients due to inadequate regulatory oversight. ASHP agrees that commercially available products should not be compounded except to meet specific medical needs or if they are prepared or if they are placed by the FDA on its drug shortage list. Furthermore, there should not be any loopholes in the law that would enable an entity to circumvent the drug approval process. We believe that the current drug approval process for new and generic drugs should be preserved as the gold standard and in no way minimized or circumvented. ASHP supports the provision that exempts health systems from being designated as compounding manufacturers. We believe it is critical to make the distinction between health systems, which are fully accountable for the comprehensive care of the patient, and a compounding manufacturer that prepares and sells its products across state lines without a prescription or knowledge of the patient to a third party for administration. In a hospital or health system, the same entity that compounds the medication is also responsible for the care of the patient. No medication, compounded or otherwise prepared, is administered to the patient unless there is a patient-specific medication order. Compounded medications prepared by pharmacy departments and all other medications used in hospitals and health systems are prescribed or ordered based on established relationships with the medical staff and other prescribers, all of whom are formally credentialed and privileged by the hospital or health system. Further, hospitals and health systems are not engaged in the retail sale of compounded products to other entities, but instead prepare and purchase compounded products for use on the patients being cared for in their hospital, health systems, and clinics. Now, in the highly unlikely event that a hospital or health system ever did want to sell a sterile compounded product by engaging in interstate commerce to an outside entity that is not part of their system, then we believe the proposed legislation, as it is currently written, would require them to become listed as a compounding manufacturer, which we would support. What makes this scenario highly unlikely is that a hospital or health system that becomes a compounding manufacturer would then not be allowed to be a pharmacy, which would prevent them from accomplishing their patient care mission. Hospitals are in the business of caring for patients, not manufacturing pharmaceuticals. Hospitals also have pharmacy and therapeutics committees comprised of medical, administrative pharmacy staff that allow safe and effective products to be placed on their approved drug formularies. They also have well-established quality improvement, infection control, and risk management committees, as well as adverse event monitoring and reporting systems. Another distinguishing factor for health systems is that they must comply with CMS hospital conditions of participation and are accredited by quality improvement organizations such as the Joint Commission. These are just a few of the examples of how hospitals and health systems function differently than other care settings and are therefore appropriately excluded from the class of compounding manufacturer in the draft legislation. In closing, I want to thank you, Chairman Harkin and Ranking Member Alexander, for the bipartisan leadership that you have demonstrated in the interest of protecting the public health and for holding this hearing and putting forth a thoughtful and well-developed proposal. ASHP believes this proposal provides the proper pathway forward to protect patients and to ensure that a harmful event like the meningitis outbreak of 2012 will never happen again. We are completely committed to working with you and the committee to see that this legislation gets passed into law. Thank you.